I'm so glad that you're asking me about obsessive compulsive disorder. It's a term that's used so flamboyantly these days. Oh, that's my OCD. That's my OCD. Being a neatnik is not OCD. Wanting your file system a particular way is not OCD. Wanting your kitchen clean is not OCD. OCD is this. There's obsessions. And there's a variety of types of obsessions. They are essentially thinking that maybe something is tainted. But if I touch it, somehow I'm going to be exposed or infected with something. The obsession could be, if I don't lock my door 5 times, it's not truly locked. And many times those obsessions might have consequences, and often very unrealistic consequences. Like, if I talk, my parents are going to get killed, so I need to be mute. I need to keep my mouth shut, or my parents are going to get killed. Or if I don't lock it 20 times, then it won't be locked and someone's going to come in and kill my family. So they might have some pretty bold obsessions. And usually people with OCD don't have just one. They have a menu of obsessions. So that's what's going on in our head. The compulsion side is the behavior that goes along with this obsession. So this obsession informs the compulsion. I gotta lock the door 20 times or it's not locked. Oh, I go lock the door 20 times. What does it feel like if I don't lock the door 20 times? I have really severe anxiety. Oh my gosh, I'm putting my whole family at harm's way because I haven't done this 20 times. I might even have a full-blown panic attack. So kind of the only way to get this anxiety reduced is by engaging in the compulsion that's associated with my obsession. We have worked with people here at New Roads where their OCD has just stopped their life. The world has so many things that could harm them. There's so many rituals they have to engage in to keep themselves safe. So here's the good news. Edna Foa, who also developed a wonderful PTSD treatment for long exposure, developed something called EXRP, Exposure and Response Prevention. And that is essentially where we expose people to the things that they're obsessing about. And we hang in there with them and keep them from engaging in that compulsion. And this loses its oomph. The obsession loses its oomph if we hang out there long enough. Because what happens, what are we trying to avoid? We're trying to avoid anxiety in this process. Trying to avoid panic. We're trying to avoid this horrible outcome or this outcome that might happen. So once I engage in the compulsion, my anxiety goes down. So we're trying to get the anxiety to go down over here. We're just tapping into what our brains are designed to do anyway, which is called habituate. If you think about the first time you drove a car, or the first time you rode a bike, or your first day at work at a new job, first time you got on a plane, oh my gosh, heart's beating, you're sweaty, you're frightened. Maybe the first day you sit out in the parking lot, you're not sure you want to go in. Most of us, it's so second nature, we pass our exit because we're zoning out so much. That process is called habituation. Our brains get bored with things if we just hang out with them long enough and enough times. And it's the same with OCD. Our brains will just be like, that's boring to me now. But we can't tell somebody. Their brains will tell them, but we can't say, no, that's not going to happen. If you can lock your door just one time, and then whoever this killer is not going to be able to get into your house and kill your family. We can't tell them that. They're not going to believe me. And even when they say, I know this is crazy, their brain still tells them to do it. And if you don't do it, you're going to get this incredible anxiety. It depends on the severity, whether they're going to need residential treatment, and because their life has become so unmanageable because of this. I mean, we've certainly had people that were so frightened to even use a toilet because their OCD was getting in the way of that. For somebody like that, you might say this needs to be residential. And then if it's not so severe and you can do it on an outpatient, somebody who has been taught by an expert, EXRP. That's what I would be looking for.